I want to perform a cranial nerve assessment. We're going to go through each cranial nerve one by one. As you get more skilled, you can group them together. The first one being the olfactory, cranial nerve number 1. Close your eyes. I'm going to ask the patient to identify a unique smell. Tell me what you smell.
Alcohol.
Okay. Popular product in the medical facility, so it's easy to have and ask them to identify. Cranial nerve number 2 would be the optic nerve, and then I'm simply going to ask her to read this gauze pad back to me.
Gauze pads. Contents sterile unless package is opened or damaged.
Okay. You could also, if you're outside, you could ask them to read the scoreboard or some advertising that might be around if you're out on a field or on a court or something. And then you could also do it clinically by doing Snellen's vision screening. But those are some examples of ways you could do that with something easy to read here, something far away, like a scoreboard or some advertising, etc. For cranial nerve number 3, the oculomotor, I'm going to do 3, 4, and 6 together, which will be the oculomotor, the trochlear, and the abducens all control eye movement. Okay, so the oculomotor also controls pupillary reaction. Okay, so basically I can look at the patient and see if they've got symmetry with their pupils. If you can change the light, you can look at constriction and dilation, and they should be symmetrical. Right now our pupils are symmetrical, and certainly can change when you shine light in them. Okay. And not only you're looking at the light, the eye that you're looking at, or putting the light in, you're looking at the opposite one to react with it. You can also look for their pupil reaction while you're moving the eyes, having them follow an object. So you're looking at several things with the oculomotor cranial nerve. About 12 inches away, have an object for them to follow. Ask them to follow the object without moving their head. I'm going to go in an H pattern, and I'm looking for the eyelids to move up, the eye to move up and down, laterally, up and down. Okay, and I can also do what's called a bow tie pattern, where I really go in the shape of a bow tie and watch again for symmetrical eye movement. Okay, constriction, dilation of the pupils, and those 3 cranial nerves control the eyelid, eye movement, pupillary constriction, dilation, and lateral and upward motion. So you can do 3 of them with one test. Cranial nerve number 5, the motor function of that particular cranial nerve is the mastication. So the masseter muscle asks them to clench down their teeth and feel the masseter muscle. You can also feel the temporal muscle when they do that. You could also have them do a light and deep touch, have them close their eye and say, that'd be a light touch, this would be deep touch. Or you can go to a different part of the body and say, that's light touch, that's deep touch. Can you tell the difference? And then you can go up here, close your eyes. Light or deep?
Light. Deep.
Okay, and you could use a Q-tip, the soft part of one, the Q-tip, or the sharper end on the other one. That's good, you can open your eyes. And basically that's has sensory responsibilities as well. The facial nerve would be the next one that we would test, and it really controls the muscles of the face. So you would ask them to smile, frown, make a mean face, wrinkle their forehead, raise their eyebrows, okay, or things that can be controlled by the facial nerve. You can test that by just having to do facial expressions. The vestibular cochlear, number 8, close your eyes. I'm going to test hearing. You can also test their equilibrium with some balance testing. I'm going to rub my fingers by an ear. You hold up the hand of the ear that you hear it from. That's a very quick screening hearing. You could also do Romberg's test. You can also observe that while they're coming off the field and while you're assessing them to see if they've got sway or if they have some problems with balance as they come off a field, etc. 9 and 10, the pharynx and larynx and pharyngeal muscles. By speaking to the patient, you're already analyzing that with their speech. You can ask them to swallow, okay? You can also ask them to stick out their tongue and say ah, and looking at the normal position of the uvula. And mostly you can gain most of that through just speaking to the patient and them communicating back and forth. Cranial nerve number 11 is the upper trapezius and the sternocleidomastoid, so we'd ask them to perform a shoulder shrug. Hold it there, don't let me pull it down. Okay, and ask them to turn her chin to this shoulder, don't let me pull it back. Chin to this shoulder, don't let me pull it back. Okay, to kind of get an assessment of how the functioning of the upper trap and the sternocleidomastoid are functioning. And cranial nerve number 12, the hypoglossal, you're looking at tongue movement, so you can have them stick their tongue out. Okay, that's normal. If they stuck their tongue out and it went to the side, that would be positive. Or you can ask them to stick their tongue in their cheek, stick their tongue in their opposite cheek. All kind of gives you an idea of the tongue motor function served by the hypoglossal cranial nerve. Cranial nerve assessment.